X-rays. X-rays are always such a controversial subject and very confusing to patients as to why they need them, why they don't need them, why their X-rays were normal by one doctor and not normal with another doctor. So if you go to your medical doctor with neck pain or back pain and they decide that you need an X-ray, they're really only looking for one thing, and that's pathology. That means, do you have cancer? Do you have a tumor? Do you have a fracture? Do you have anything going on inside of you that would require a drug or surgery? If you're not likely going to have one of those things, they may either not take the X-ray at all or get the X-ray back and go, it's normal. It's about what we expected for someone your age, or it's fine, or it's nothing that you need to worry about. And they may not even show your X-rays. That's the end of it. That's the end of the story. Your X-rays are fine. Now at CORE Chiropractic, we do things a little bit differently because we're taking our X-rays weight bearing, number one. So all X-rays are not going to be with you laying down on the table. We want to see what you look like when you're standing in posture, when the gravity is affecting your spine. And then we take measurements. Now the measurements are for two parts. One is we want to see a starting point so we can see that you're improving, that you're changing over time. The other part is it's going to guide how we do our adjustments. That means that a bunch of doctors can all sit there and look at you and check your spine and have very different opinions as to what's out of place and which direction it needs to go. But when you take X-rays, you can take measurements and you can see for yourself which way that bone has moved, which way it needs to go back. You can see how far. You can see, is it just back a little bit or is it shifted back in, and exactly how far, and use the X-rays to guide how you do your adjustments. Now, our doctors are still going to feel your spine. They're still going to see what is stuck and what is not stuck, what needs help and what doesn't need help. And then we have a little cheat sheet that we look at every single time that tells us what happened with the X-ray and how that bone needs to move. And so we're going to use that as a frame of reference throughout your care. We'll take periodic re-X-rays. Usually we take one at the end of your initial care plan and then every couple of years after that, just to see where you're at so we can continue to use that information to guide how we adjust you. So were your X-rays fine at your medical doctor? Absolutely. You had no pathology, you had no cancer, you had no tumors. But we are going to use that information a lot differently than they are, because we're not looking for something to cut on. We're just looking for how we're going to guide things back into place. And for us, X-rays are essential in making sure that you get the best results possible.